Hello everyone, I'm Alice Dong. I am the Senior Policy Analyst at the Asian and Pacific Islander American Health Forum, and I'm speaking to you today at a historic moment in our nation's history. Last night, on March 21st, the House passed the Senate version of the Healthcare Reform Bill, as well as the Reconciliation Bill. The Reconciliation Bill simply being improvements and fixes to the Senate bill. So let me first tell you where we've come from to get to this historic moment, what this historic moment means for our communities, and where we'll be going in the next several weeks and probably for the next several years as we continue this fight for healthcare reform for our communities. About 1 year ago, we started this healthcare reform process rolling, and we were very optimistic at that point as to what we could achieve for the Asian American, Native Hawaiian, Pacific Islander communities. And the Senate version of the bill, which the House passed last night, certainly achieves many of these issues, and we are pleased with that. And of course, we are seeking to complete healthcare reform for our communities and making sure that the issues that have not been addressed will be addressed. So let me tell you first a little bit about what is in the Senate bill that we can celebrate. For our communities, affordability is certainly an issue. The Senate bill provides for the creation of state-based exchanges, which are essentially marketplaces that would provide affordable health insurance coverage options. And it's through these exchanges that affordability credits, or these tax credits, would be provided to low and middle income individuals. So generally around 100% of the federal poverty level to 133% of the federal poverty level to 400% of the federal poverty level. In addition, the Senate bill would expand Medicaid to up to 133% of the federal poverty level, as well as to childless adults for the first time. Our communities have also faced many challenges in healthcare settings with regard to finding a provider or a doctor that is culturally and linguistically competent. The Senate bill has provisions that would provide training in terms of cultural competency and linguistic competency. So we're certainly pleased with those improvements. Additionally, for our communities, the fact that we're continuing to suffer significant health disparities around issues like hepatitis B, cervical cancer, breast cancer mortality, these are significant health trends that must continue to be studied. So in terms of data collection, that is a significant piece of healthcare reform for our communities. Without proper data collection, we are going to be missing a lot of the serious health trends that are persisting within our communities. Right now, many of the healthcare studies that are done either don't include Asian Americans or group Asian Americans and Native Hawaiians and Pacific Islanders together. And these types of studies essentially mask the true problems that are going on within our communities. And so we're very pleased that the Senate bill recognizes the importance of data collection. Now, all of these certainly represent major improvements to our healthcare system that our communities critically need, and for that we thank the House for passing the Senate bill. However, there are significant issues within our communities that have not been addressed, and we are certainly concerned and will continue to fight in the coming weeks and months and years for these issues. Right now, the 5-year bar is current law, and what this means is that newly arrived immigrants within their first 5 years, despite meeting the income qualifications for Medicaid, cannot access Medicaid. They must wait 5 years before they can enroll in Medicaid. These are tax-paying legal immigrants that cannot access Medicaid, and considering that it's for 5 years, that is simply too long for these individuals to have to wait for an affordable source of regular medical care. Another major issue facing our communities is the fact that undocumented immigrants are kept out of the health exchanges. So even if they can pay in full for health coverage through the exchanges, they are still prevented from accessing the exchanges in the Senate bill. this is bad policy for a couple of reasons. The first being that, as we all know, the more people that pay into the healthcare system, the cheaper healthcare will be for everyone in the system. The second being that when we start excluding based on citizenship, it means that they're going to be creating a citizenship verification system. In the past, these systems have proved to be extremely expensive and essentially completely ineffective, by which I mean that most of the people that they are excluding will be eligible individuals. And they'll be excluded because they don't, for example, have the ID that is required at the time. And this will disproportionately affect single parent families and minority communities, and certainly the low income. The studies that were done on citizenship verification systems in the past have also shown that they've excluded maybe a very small handful of applicants due to immigration status. So we see that this is simply a policy that does not make sense, but it is included in the Senate bill. And so for that reason, we're quite disappointed. Again, the Senate bill, the next step for the Senate bill is for it to be signed into law tomorrow at 3 p.m. What we're looking at today and for the next several weeks is the reconciliation bill.